Okay, we're live. Hey, America. It's probably February 20th.
It is February 20th.
And here we are. And there's a lot that's going on in the world and in America today. So we're going to have a great news show. Lisa's got a lot of opinions. And then we have very special guest, former coworker for 20 minutes, BJ Boyle, who is, according to his bio, an award-winning Chief Product Officer.
Ooh.
Don't believe everything you read on the internet. Okay.
Well, I just wrote a great post about that on LinkedIn. So he's going to come back and he's going to tell us about product. Maybe, I mean, you can actually say whatever you want. We just assume that's what you're going to say, but we're here for anything.
Fantastic.
And now Chief Product Officer at MacroHealth.
That's correct. Yep.
Got it. I did look at LinkedIn. So we're excited to talk to you. BJ, anything you would like to leave our loyal fans with before we send you to the back?
No, I'm super excited to be here. I've stalked you all as a loyal listener, first time caller. That's what we'll say. Okay. So excited to be here.
Honor of a lifetime.
That's right. Thank you all.
All right. We'll send you back.
Amazing.
Okay.
Kat, the chai is piping hot.
The chai is piping hot. Do you have your mug? Do you have your chai in your mug?
Right here, literally right there.
Oh my God. Wow.
There we go.
That is fantastic. I am delighted to talk more about that. Also, we're going to a Bollywood party, so it's all totally appropriate.
Oh my God.
I bought stuff.
Whoa. Okay.
Not as much stuff as other people, but I bought
truly amping it up, really showing up for
some
big innovation party.
Big inside jokes going on here today. So Melissa, tell our loyal fans how you crushed our show lineup at Vibe for next week.
Oh my goodness. Thank you everybody for reaching out. Some of you reached out way too late because you were not listening and now you are suffering. I am so sorry. However, HIMSS is 17 days away. Agreements are out. Slots are open. I've already booked a few, so please do not ask me to book you after we are completely booked. I don't even know how many shows we're doing yet, to be quite honest. So more to come on that.
We'll see what happens.
You and me both.
Yeah, kind of trying to figure that out. Also, if anybody wants to meet me to talk about my actual paying gig that you guys do and do justice involved healthcare and all those things that I love, please
call Melissa.
Reach out to me. I would love to have a cup of coffee, more likely a glass of wine, and would love to have an opportunity. Sorry, I'm plugging myself in right now, Kat. Apologize.
Love it. That's what the talk show is for, Melissa. Plugging in. Plugging in. And all of America, in case you haven't seen it, Melissa did write an awesome op-ed about her experience with the justice system failing someone that she's close to. So you should totally read that. We'll post a link in the comments, most likely tomorrow when we get to it. Yeah, but it's awesome. Go, Melissa.
Thank you.
All right. Lisa. This is the longest week and the shortest week all at the same time.
Oh boy. A lot of stuff happened.
Yeah, let's talk about it.
Yeah.
So also it's Mardi Gras, Ash Wednesday, Lunar New Year, and my birthday all wrapped into one. And here we are.
Today is not Ash Wednesday. That's actually was Wednesday. Was Ash Wednesday.
That's what I'm saying. This week, everything was this week.
Okay, fine.
Wait, Lisa, listen. I don't know why you have to be so exact.
It's my personality. At this point, you know it.
I know, it's so weird. Anyway, I wonder if we're just so far apart on that it works.
Totally. I really want that sweatshirt that Max made for me. It looks so great. I would totally wear that.
When I saw this, I was like, okay, so Max just posts our heads on other people every week in case no one has been able to tell what's happening here. But this is someone else's image. We don't know what it is, but I do so like if it's I don't know if it's a drop skirt that I'm wearing or
it looks like it is. Really nice.
That too. So she did a great job.
So good. So
great job, Max. Okay. So let's start out with all the changes at HHS, which we covered last week, but have continued. So as everybody heard last week, Chris Klomp is now the chief counselor to HHS, which in my bad interpretation means he's running HHS except for RFK. Lisa, accurate?
He's also the chief of staff of everything. And the previous chief of staff went somewhere else or is doing something else. So I would say the chief of staff, first of all, runs everything, as we know, just runs everything. And then second of all, they created a new role or elevated it to something different. And so, I mean, as far as we can tell, he's running HHS. I mean, in all but name, he's the big boss, which is amazing. what a rise. What an incredible trajectory for our friend Chris.
Yeah, no one should be surprised. Chris always does stuff like this.
Yeah.
He's always.
I wasn't like shocked. I was just like, wow, that was fast. You know, that was more.
I don't think too, like knowing Chris and knowing he's a badass. Like I still was like, wow, I don't think he's even been there a year.
Checking the watch here.
Checking it out. Anyway, so that's great. Congrats, Chris. And it looks like more stuff happened. So the rumor last week, which was in Politico, so not just something we made up. Is something. Oh, look, Rachel Lieberd's coming in hot. Yeah, Rachel.
Ooh, you'll have to wait and see, Rachel. It might be an alternate.
I don't know. Yeah. So rumor of last week was that Jim O'Neill was going to be made an ambassador because he got uninvited to his job being the DepSec for various reasons. But it turns out, no, he in fact is going to be nominated to run the National Science Foundation. Which is interesting. This is rumor mill. This is a rumor mill from like 40 people who were telling me this. And Lisa, maybe you heard too, that one of the reasons he was uninvited to his job, and again, I don't hang out with Jim O'Neill. We're not friends. This is totally rumor stuff, is that he was held responsible, as I guess he should be, for many politicals at CDC canceling contracts and then funneling them to like their second cousins LLCs or something.
Which can I just
bad.
say, no, can I just say for a second, if somebody wants to do a crime, I would appreciate if they would put money in my direction. I also technically still have an LLC hanging out there somewhere. If you want to toss me some money, why don't you just do your crimes with me, please?
Well,
and that's allegedly, just to be clear. Allegedly. Oh, sorry. We're an LLC.
Is it LLC?
Allegedly, but I'm just saying, as Kat and I have explained, we've explained so many times, we like money. You can send us money. You can just deposit. You can like Zelle us probably or Venmo us. Like you can. We take money. So while all this is very like allegedly, like, you know, I would just encourage you to think of us as parties to your alleged crimes. Thank you.
I mean, yeah, the other thing, like Melissa's saying here
Melissa's like, please send us money.
We actually have, it is a Stripe link on our website, www.healthtechtalkshow.com. You can just click, like you want to do some fraud and you want to funnel some money somewhere. Why does send us money?
We're not promising we'll do anything, but we're just saying we love to get money and we'd be very happy if you sent it to us instead of like your cousin's like best friend from high school or whatever. Like send it to us. Send it to us.
Like we're doing important fake news reporting. We need
100%, you know, or take that money and subscribe to journalism as Kat does. And I sometimes do.
Oh my God.
You know, real journalism.
Because often they let me do a +1 when I subscribe to all of our friends' things. And so she also benefits from that behavior. But okay, like in real life, if that's true, like that sucks.
That sucks, man. You know, like again, you can't on the one hand say that there's fraud, waste, and abuse. There you go. Support us. You can't say that there's fraud, waste, and abuse and then do it yourself. Like, don't do that. Come on. Like, what fraud, waste, and abuse is when you take contracts that were intended to go to support like really important mission critical work of keeping people healthy, and then you give it to someone who doesn't deserve it, or the canceling of the contract wasn't warranted. That's an example of that. Like, we need integrity in all of our systems. And this is one of those examples. So like, if true, big ol' if, like, I don't have any other information. I genuinely have no information beyond just being a punter on the internet here. But like, come on, man, that kind of stuff is like, that just falls right in the category.
It's like super uncool. And if that is true, if that's found true, I mean, I know we're not prosecuting people for crimes in the Epstein files either. So like, I guess whatever. But
unless you're British, former prince.
Well, okay. Well, let me finish my thought and then we'll talk about Prince Andrew. But yeah, like if that's true, like he shouldn't run the NSF. Like,
yeah.
The NSF also gives out a lot of money, you know, and I'm sure it was like a lot of people under him. I know he was running the whole department plus CDC, whatever. That sucks.
He had a bunch of jobs. That's the other thing, right? Do you have the other slide about who's running the CDC now?
Hold on. Oh wait, but also Prince Andrew. You know that guy? Yeah. He was only arrested for, what was it? Misconduct in office or something?
Misconduct in office, baby. Yeah.
Okay. Anyway, so Jay Bhattacharya is also running the CDC in addition to the NIH. Seems like a big job.
Yeah. Yeah. I mean, listen, sounds like a hard job. Hard to find someone to do this permanently. I don't think there's any chance there's going to be another Senate confirmed CDC director in this administration, which, like there are some things you can and can't do when you're acting versus permanent. But for the most part, like, yeah, just staying acting is probably a way to avoid the scrutiny and the oversight that Congress would provide. There's a reason why some of these top spots need to be like Senate confirmed, or why they were made Senate confirmed, to provide a little bit more of those like checks and balances around who is leading these like critical agencies. And if you have someone just stay in the acting role and never put somebody forward to be confirmed, like our friend and Dr. Menares was confirmed, the first Senate confirmed CDC director, that then you just avoid that oversight and that accountability. So it's a bummer,
Lisa, you
whatever.
know stuff. So I've been reading a bunch of stuff, but not too deeply, obviously, where it said there can only be an acting director for 210 days. Is that each acting director gets 210 days or 210 total?
I have no idea. I bet it's like each, which means they can just kind of keep bouncing it around. Because then what do you do? You legally have to have an acting director. You have to have somebody who's named the director. So if they say they just like run out the clock, then Congress is like, okay. So you just put a new person in. No problem. Easy peasy.
Yeah. Well, I mean, maybe Lisa, maybe we'll get our turn.
Listen, we have been asking. We have been putting ourselves forward. We have been saying, listen, like we will. I don't own anything. I don't own any like major. I don't own any major investments. Like I don't have any conflicts. I'm happy to jump in there. I'll jump right in there.
Take Lisa. I can't come. Don't call me. I gotta send my kids back 29 plans. Maybe later. Call me later. Okay. Anyway,
listen,
so we'll see what happens.
Mazel, like do the right thing. That's what I have to say.
Yeah, do the right thing. I did hear though that Dr. Bhattacharya has gone to Atlanta, which is more than Jim O'Neill is.
More than Jim. Yeah.
So anyway, we'll see what happens here. Maybe we'll get a real one. Maybe we won't. Oh, also back on the Jim O'Neill thing. This is also, I think, Senate confirmed. The NSF.
NSF. I'm not. It says if confirmed by the U.S. Senate, so I assume it is Senate confirmed. There you go.
Must be why I know that because I
must be why you know that.
A couple of minutes ago. Yeah, I don't know.
Brilliant.
Whatever. We'll see what happens. Okay, what else? Okay, so like all this stuff was happening, right? And like last week, right before they announced Chris Klomp is basically running HHS, there was all this stuff coming out from the Maha people saying like the Republicans better get in line with Maha or you're going to lose the election, blah, blah, blah. And so that has only intensified this week, especially because RFK Jr. came out in support of Trump's order that keeps Roundup in the arsenal for U.S. farmers.
Yeah. Listen, I, as you know, as we've discussed extensively, Maha as a concept, like the things that are underpin Maha are like, for the most part, things I agree with. And if you're going to like ban Red 40 or whatever, you're probably at more risk from frickin' Roundup. Just saying. And also like there's other things like there's asbestos, by the way. There's a whole thing about asbestos and unbanning asbestos being used in certain areas. Guys, what are we doing here? How does asbestos and Roundup like make us healthier?
Yeah, the thing is super confusing. I will say in general, as someone who grew up on a farm and who ate organic vegetables and foraged in the woods and still does, like the U.S. food supply will suffer if we remove, and this is Roundup is the commercial name for the glyphosates. But so I do think that Maha land should be considered. Like, remember when we went to the Maha Institute and we heard that influencer talk about how the poor people in Mississippi should just grow more food on their commercial farms?
I blocked that out because I was like, I saw like full red. So I was trying to forget that I heard that.
Jesus Christ, have you ever worked on a working farm? Like, no one has time to grow their own goddamn sweet potatoes in the side over on the edge of the field there. But anyway, I do think that if we're going to remove pesticides from U.S. foods, which I'm here for, absolutely, we should have a solution to ensure there's not a disruption in the food supply, because I do think it's better to have people fed than to completely remove Roundup from the farming system. But, I'm just someone on the internet who grew up on a farm. I don't have any experience in any of that. So whatever, it's fine.
Yeah. I mean, gotta be realistic, but also at the same time, pretty sure that the use of pesticides is one of the things that separates our food system from others.
Yeah, it is. It is. Okay, so also the Maha people are full force out. There's lots of drama with the Maha people. Some of the other things that are happening are, I think this is also related to RFK. What was his nonprofit? The anti-vax nonprofit, Children's Defense Fund
the Children's Defense something.
Yeah, there's a bunch going on. There's a bunch of things going on here. But the CDF is, I guess, trying to intervene in some lawsuits so that doctors can do whatever they want related to vaccines. I don't know. We'll see what happens, because I think the AMA is coming in, or maybe it's AAP is coming in hot on a lawsuit that looks like they may succeed to argue against the vaccine schedule that's just been modified. So anyway, there's lots of Maha v. Republican stuff going on right now, which is kind of exciting. Related, last week, I think it was last week. I can't even remember. Right? Last week, the FDA, Vinay Prasad said, because we had him in our deck, said no go to Moderna and their flu shot, rejecting, I think, one of their control methods or something like that. So just said nope. Moderna appeared to, at least in my perspective, do an incredible PR campaign affront against that the very next day. And due to pressure from the White House, the FDA has reversed that decision.
Yeah, I mean, I think, again, Kat and I have a good sense of what actually goes on with these companies when they are feeling threatened on a policy or a PR side. And, just reminding everyone that the things that you see are very likely strongly influenced by commercial interests. Now, in this case, I am very supportive of Moderna's work with an mRNA flu vaccine, as we've discussed. But just know that all the little stuff you see, those are all influence. There's little influency things happening to make them happen. And Moderna did not take this one lying down, is how I would put it. And they benefited from the change in tone and the change in environment right now, which is smart, right? You got to influence. You gotta time it well.
Yeah, I mean, the other thing that I think is interesting here is I think Moderna, they have some massive private equity backers, right? I think BlackRock, this is an important asset for the U.S. financial system too. And I think sometimes, Vinay Prasad and I don't hang out either. I don't know what he's thinking, but it did seem like maybe he underestimated the force of what he was dealing with. And like we said last week, Lisa, I don't care if you like mRNA vaccines or not. This is America. We should have all the things and then get to decide if we want to take them if we want. So I'm delighted that we will have this thing, maybe, probably, and we can decide if
I'll take it or not. I'll do it.
Yeah.
They should honestly all test their products on me, because I am so pro vaccine and so pro flu vaccine. I would absolutely sign up for that. I have signed up for a vaccine.
Yeah, weren't you a
J&J baby?
Yeah, you were the J&J.
Listen,
you were the J&J.
I'm ready.
Do you know if you got it? Did you ever?
No, I didn't get it. I didn't get it.
Okay.
I found out I was in the control group. Yeah.
Bummer.
Which I actually ended up leaving it. I was in the control group, and then I actually got the J&J vaccine anyway. So it's all good. It's all good. I got plenty of vaccines. Call me Moderna if you need any influencers. Again, I'm going to be a flu vaccine influencer.
Oh my God, call us. Oh my God. Okay, we got a few things to get there before we get to some of the fun stuff we want to talk about. Okay. So this is just FYI, in case everybody forgot about the provider directory that CMS is doing. They're still doing it. It's coming.
Yep.
Coming in hot. Here we are. I don't think this is a terrible idea. There are too many provider directories.
It's not a terrible idea, but who actually ends up doing this is the big question. As a reminder, they did this via a trial sort of procurement where they did a $1 procurement for people who are doing kind of a bake-off. They're doing a bake-off methodology for the procurement, which is good, except for it. Obviously, you have to be a company that has a pretty significant amount of capital sitting, waiting to do this kind of bake-off. It's fine. I get it. CMS is not a side project, but we'll see. We'll see who actually gets this.
Yeah, we'll see what happens. This is just more stuff about like Lisa said, the moment is changing. Maha
tides are turning, babe. Tides are turning.
This is a great article from Politico because it talks about all the crazy shit that happened last year and how much of it has actually been overturned or walked back or anything like that. And one thing I'm very proud to say here is up front that basically last month, HHS reinstated all NIOSH employees. So remember in April, I think the April 1 RIF, NIOSH was abolished. This is a part of the CDC that did like coal miner stuff. I guess, yeah. What makes me mad about this stuff is like, okay, like what actually didn't get abolished? Like what a waste of money. Like what a waste of drama.
A lot of money was wasted. A lot of people's lives were overturned. I know no one wants to think about like the poor federal employees, but keep in mind those federal employees are in many cases like long-term, like dedicated, low pay, mission driven, like have actual expertise. They're like, you know, they've been doing it for a long time for a reason. Usually they're not doing it because they want like fame and glory. They're doing it because they're serving their country, whether you like it or not. And I think, people's lives were totally overturned. And you're like, oh, well, so sad. You get a new job, right? The economy was shit for new jobs. And also people had very specific areas of expertise that were specifically around some kind of very important federal program like NIOSH, you know? They're like protecting people, keeping them safe. And can they go into industry? Sure. But that's the swamp. The industry is the swamp. We are the swamp. Cat, you're the swamp.
Me.
Cat is the swamp.
Yeah. I also think like just back to all this, like I'm like always down for being able to remove people who are not useful or not serving the purpose of your organization. Sure. Again, back to this whole thing. They just cut like whole teams or they cut the people on probation.
Not based on any kind of performance, quality, expertise, need. They just did a full cut. And so that's where it's just like, hey, you know, you can say like, oh, well, it got fixed. There was a huge amount of money, by the way, and time and distress and like messing up people's lives. You know, I don't have any sympathy for that. Like I get the need to be efficient. I get the need to like have people there based on performance. I get all that stuff, but like this was not a super successful endeavor.
It's pretty dumb. It just seems wasteful. Also, like I'll go back to my point that I was making in like Q1, Q2 of last year. Like, do we need to pass a does Congress need to pass a law to make it just easy to get rid of federal employees who are awful? Like, would that
That's not how unionization works. You will not like the answer.
Unionized. But they're not all.
The vast majority of the federal workforce are covered by unions intentionally. Even if you aren't a member, they are negotiating on your behalf. So like I said, you're not going to like the answer, but they're federal unions.
I don't like unions. We'll move on. We'll come up with a solution next time. So speaking of interesting things, that things have changed around a lot in today, from Emma Bevins from Fierce Healthcare, there was an article kind of chronicling what's happened with CHAI, the Coalition for Health AI, over the past really 2 years, it sounds like, starting in 2024 with their AI assurance labs and how that's changed and how they have evolved internally. Lisa, what are your thoughts?
No comment. Listen. Emma is unfortunately leaving reporting. She's announced this on her LinkedIn. She said, this is my last article with Fierce. And I would just say, you know, for a younger reporter, she did a fantastic job. This is a really detailed article, has a really detailed timeline. You know, and so it's worth reading to understand sort of how this organization has been mired in sort of controversy through multiple administrations now, right? If you look back, and by the way, I was lying about no comment, obviously, because I'm commenting.
You never have no comment.
No comment. And let me tell you my thoughts. And so, oh, too good. From the beginning, when there were specific seats for people in government, former national coordinator Mickey Tripathi had a seat, for example, and also a guy from the FDA whose name I always forget. I'm so sorry, dude.
I forget that guy's name. Yeah,
I always forget your name, and that's on me. It's my bad. They had seats on the board, and it was this whole thing. And you're like, okay, is this like government sponsored? And if so, is that kosher? That this is like a thing that is, being like run by a private nonprofit, but is making decisions about AI governance at the HHS level. And so that fell apart pretty quickly. There's a lot of complaints about there being, government leader seats on it. So from there, it just went, downhill. And by the way, Jim O'Neill was very involved in some of the criticism of Chai, and now he's, out the door. I don't know if this changes anything. I don't think there's a lot of love lost. I think they've had a couple of like ups and downs. Are we doing assurance labs? Are we doing something else? It doesn't seem to have like played out. So the question is again, like, what is the role of this organization? They don't seem to have a really big connection with the government anymore, or any at all. And then also they had a bunch of tech companies that joined in the beginning who dropped out, who left. All the big ones left, and no comment from them, but they are all like, we left, and I think that's kind of the comment is we left. And so I think just, read between the lines.
Yeah. I'm also just kind of like, like sometimes organizations go under fire, right? Like sometimes bad things happen. I just feel like the response here, specifically individual outreach, was not well advised. Hopefully they have a good grade.
Oh, and we lost her.
It didn't seem like they did at the time, but I also trying to pull their. Oh, sorry. I was just saying they should get a good person for reputation management, because clearly. Oh yeah. Am I not back? What?
No, you're back. You're back.
Anyway,
Just give the pixels a minute to catch up. It's fine.
Yeah. Okay. I'm just saying, like, when you're personally under attack, which happens to both of us, relatively often. You reaching out and sending people douches is probably not the move. Just saying.
Let me make a personal appeal. Please remember that when I make any like dumb comments here, they are on behalf of my personal self, my personal ideas, not anyone who I may ever be employed with or work with in any possible way. This is just me and my dumb opinions personally. Thank you.
Welcome to our fake news show.
That's right.
Last thing here. The Jim O'Neill thing, I don't know, because he did seem very involved in trying to just throw it down. But it does seem like many other parts of HHS were also in on that. So I don't know what's going to happen here. But it does look like there are lots of other AI certifications, different things, kind of like how we deal with high trust and SOC 2 and stuff now, which I don't think that's a bad thing. Like, I don't know, like, may the strong survive. That's all I got to say about that.
Well, and beyond that, like the administration and Congress have all said very clearly, like, no regulation on AI in healthcare and elsewhere, and no laws. And the only regulation or law we're going to try and pass is the one that says that states can't make their own laws to regulate AI, which is, as we've discussed ad nauseum on the show, something we don't agree with. We think that states should have rights as granted in the Constitution, and we feel like that is very objectionable. And so, with that kind of posture from the federal government and from sort of the associated lack of interest from big tech and even small healthcare tech and health AI in being part of this, thus more questions than answers. Let's just say.
More questions than answers. Yes.
Next slide.
We will see what happens. All right. So this was cool. I think actually Abhinav, CEO of Innovacer, is quoted in here, and Krista McFarlane, someone we see around the Health Data Palooza circuit, wrote this article just about like how potentially unsafe it is to just throw your medical records into the AI.
Yeah, it is. And Krista is a friend of a friend. Abhinav was quoted as saying, AI isn't failing healthcare. Healthcare's architecture is, which obviously I agree with. And I think But I also think this is an interesting framing. And obviously Krissa, she says like, hey, bias alert, like my company works on like blockchain for health records and we want people to get paid for their use of their records. So whatever, I get it. That's her perspective here. But it's a good point, right? There's lots of ways that, health like AI companies are trying to get you to kind of share your records, and then use them for training. That's just kind of a neutral statement. It is true. It's not untrue.
Yeah. Also, the thing that you might not agree with, kind of related to this generally, is like most of the health tech AI ecosystem really just wants a shit ton of data right now. And I believe that's one of the drivers for kind of
100%.
the information blocking rules and, saying that the payment terms are different. And I don't know if I totally agree with all that. Like, I think you should pay for data. Obviously, given
I think you
my
should pay for
personal
data. No,
interest.
I don't think we disagree on that one. I think that, fundamentally AI requires data. There's a need for more and more. The need is endless. The need is ever, it's a bottomless pit. And, trying to get data in as many ways as possible, especially in the healthcare arena, is absolutely going to happen,
Yeah.
Like I said, neutral statement here. It just is.
I do think patients should get paid for directing their health data, though.
I agree. Check out Krista's
I don't know
about
organization. I know her. Yeah. I don't really understand how blockchain works yet. So, but generally into the idea.
Maybe she'll teach you.
Yeah. I think she lives in Atlanta, but I can't remember.
I think she does too.
Okay. Yeah. Also, we're going to be at Vive, like Melissa said. We're going to interview all these people. It's going to be totally awesome. We'll probably,
so cool.
Theoretically, most likely 100% sure having a special guest at 4 p.m. Pacific on Monday that I think all of our nerd fans
so excited about this one. Oh my God, you guys. I can't tell you, we can't tell you, but holy smokes, it's a big one. We're so excited.
Actually, can we tell them? I think we can.
Is it confirmed?
It's confirmed. They accepted the form and everything. Like,
okay, I don't think I don't think that's confirmed yet. They have to actually run it through.
Hold on. I'm pretty sure it's good. Hold on. Loyal fans, wait 1 second. While
you do that, I'm going to pop up some of the comments here. We've got a nice one here, right? Because linen wearing owner of function really care about your health. That's exactly the point. Yes, data is the goal, Doug. I agree. Nice. Got a couple other good ones. Yep, We Are the Swamp. Those of us who work on the continuum and in the community are left without the tools, knowledge, or resources that our community members so desperately need and deserve. I agree. And then, our friend of the show, Michael Marchant, fan of Krissa. She's all around the world. Good for her.
Love it.
Nice. All right, so we'll be at Vive, and do you have we're also, Kat and I are also speaking like as part of our regular realish jobs. Each of us have panels and things like that too. Yeah,
it's going to be great. Okay, great. So it is confirmed. The thing they also recently accepted our unscripted is fine.
Okay.
So all right. At 4 p.m. Pacific on Monday, we will be having a very special one guest episode with Abe Sutton, director of CMMI.
Yay!
Yeah, which is great because hopefully he'll tell us some stuff. We don't know what he's going to say because they accepted
it's unscripted
thing. Yeah. So that's really exciting. So we're excited for that. We may or may not post something before that to let you know that that's happening, but it will happen. Which is great.
Yes.
Okay. All right. We're going to move on to our real guest here. BJ, what do you think of the Coalition for Health AI?
Sorry, you're breaking up. I feel like I have to give all the disclaimers like Lisa did already as well.
That's awesome.
Legendary.
Okay. Yeah. Don't worry. We already dug ourselves in a hole there, so we can move on. That was good.
That was good. That was really good. Good thinking on your feet. I appreciate it.
Hey, first of all, I just want to say for the record, how cool for our former coworker, Chris Klomp. Such a force.
Yeah.
And that's awesome. Right?
Unbelievable.
It's good for us all.
Yeah.
It's a force of nature.
And Wiley is over there saving America too. I'm not exactly sure what he's doing, but he's working.
I know.
Top secret with his hood on, probably, right? But yes, well, we're better for it.
So I will tell you, the only thing I know for sure about Wiley is it appears that he wears fewer hoodies and does wear professional attire, at least when I have seen him in DC. Yes.
Okay. So. Heck with your guest speaker. That's the breaking news.
I know. That's but yeah, they're over there saving America. I think it's awesome. You know, I guess founders all travel together.
That's really cool.
Nice.
Yeah. Okay, BJ, what do you want to tell us?
Where do we start? Where do you want to start? We got lots of opinions, of course, but I don't know. I could probably represent lots of things. Just from a product perspective, and you kind of talked a little bit about my background. I was a long time ago. I was at a startup where we were building products for nursing homes, and I was at Cerner, and I spent the last 9 years at PointClickCare, and then I took on a new role here at MacroHealth. But product roles in healthcare should be the same, which was we should really try to solve meaningful problems. So jump off from there, wherever you want to go.
Yeah. Okay. Well, a couple questions. So, is it the same? Like, does the content matter when you're like a big time product person? Like, did it matter that you were post-acute, like hardcore, and now it looks like this is more of like a marketplacey thing. Like, does that matter, or does the stuff translate over?
It's a good question. We think about this all the time when we're hiring people. So anybody listening, I'm hiring, by the way. Here's what my view is that the higher you go up, healthcare experience matters, like broadly. Like it's hard to be pulled in from fintech or some other just high tech space and try to understand the craziness that all of us are still trying to understand all the time. But I think in general, once you have healthcare context, I think you can jump aboard, right? And I also think we have to be careful not to over rotate. Like, I think about EHR companies like PointClickCare or others. I think in the early days, we had a lot of nurses and clinicians and hand-on users. We put them in the product role, and they were great at like understanding what the voice of the customer, the user needed, but it was hard to translate into what the engineers and the teams need to build, right? And so I think it's a combination, right? You got to have that heavily engaged with the customer, but we need product people too. So.
Yeah. Well, yeah. So observations / question on that. So I know, even in the early days of Collective, we did similar things, right? We were and again, fantastic at figuring things out and working with the customer and understanding how the product is actually used. The issue that we always ran into was that users are not buyers. Yeah. So we often had like the translation issue there where, like we would have the most motivated emergency department social workers, and they were freaking awesome and they were doing God's work. But then like there was a huge gap between like, okay, well, why is it something that a CFO should sign off on? Which was a tricky thing.
Yeah, we have to be. I think about how we tell the value story up and down the org chart, right? I mean, even you all have spent lots of time over this talking about interoperability. We could spend all day talking to the IT team at a health system or a different tech company, and they're not the ones making. And sometimes our incentives aren't aligned, right? So we need to. The thing that I think speaks universally, though, Kat, which none of us do an awesome job at all the time, is just actually focusing on ROI, right? Like how many companies tell you, hey, we're going to reduce readmission? Like if you stacked up all the companies that reduce readmission, we should be.
There's no readmissions.
We should never have admission, right? Yeah. So like how do we become real and like really measure our impact and just show up that way, right? Like where I'm at right now, not everybody probably wants to hear this, but like the regional health plans and the health plans based off systems are under a ton of financial pressure. And they're getting approached by, like, I had a customer tell me they were being approached by like dozens of point solutions every week. It's really hard. How do you filter out the noise? And like, you need to show up with a strong value prop and ROI story and say it to each level. But So.
Well, you have to also prove it. Like, I mean, you know, now I said I wouldn't talk about my day job, but in my day job, we have a whole thing called value engineering, right? Where we have to go. This is not like totally unique concept. We have to go with every customer and say, we promise to do X, and like, how close to X did we get? / can we prove out that we delivered that X for you? And what does that look like? So I think that's really important. Looking at MacroHealth generally, because what you said is important as well, right? There's a ton of, you know, like regional, we all can think of the big baddies, the big payers who were like, oh, you're so mean. But there's a ton of like community plans, regional plans who they're not rolling in cash, right? They're not like, you know, on their like private jets to wherever, right? That's not really their thing. And so they have to figure out how to deliver some kind of outcome that, you know, that results in a reduced expenditure and better health for the people whose healthcare they're paying for. And one of the things that I think you guys do is try to connect them to sources of care or different types of care that will help them meet that need. When I think about that, I think about obviously the basics around like, you know, the providers, primary care specialists, et cetera. But then also this push we're seeing from CMMI around paying for outcomes through the future access model, digital health companies, other ways of non-human driven care. Are you guys tackling that aspect of the market as well?
I think that's our goal. Let me take a step back because I love what you're saying. It's like, it's, you know, we're kind of in this category creation play. As a side note, I can't really talk unless my hands are moving. It's just natural. But I don't think, maybe I'll make a statement that people will push back on, but I don't think U.S. healthcare is a system. It's a market, if we think of it that way, right? And so on one side, you've got groups who pay for or sponsor healthcare. You've got the regional plans, you've got employers, TPAs, et cetera. On the other side, you've got providers or networks or service providers, Lisa, right? That might be showing up now with the new models. And what we find is that if you're not like the really big national health plans who have these vertical integrated stacks underneath your logo, it's really hard to be a shopper in the marketplace and say, what's the right mix of providers? Because you've got hard to find them. And then it's really hard to connect them, because if I'm a small regional health plan and I'm like all those point systems we talked about, that would sound good, but I have a backlog a mile long to connect them, right? And so our premise is a marketplace means you connect once to the marketplace, allow us to help you optimize and identify who your partners are and connect. Pharmacy is the best example of this right now. Like, you know, PBMs are probably decidedly under a lot of scrutiny. It's really hard if you're a smaller or even mid-sized employer or plan to break apart your PBM, right? So the Blues out in California got some recognition, I don't know, earlier last year, where they kind of disintermediated the stack, and they have but that takes a lot of money and effort and people, right? And so our position is how can a marketplace allow you to say, you know, I should be using, I don't know, Mark Cuban cost plus drugs for my diabetes meds, and maybe I should be using somebody else for my specialty meds, and how can we do that in a way that's cost effective? So that's the idea, right? And so how do we help facilitate that?
Yeah. You're trying to give them access to a marketplace that can be made up of multiple components that you wouldn't otherwise be able to access at the size that you are or the scale that you are.
Our premise is that you've got we're kind of building a set of partners, right? And so maybe loosely modeled after like our friend Mandra did back in the day at Athena or others, right?
Yeah.
It's a different model, right? But so you say, give us the data, we're going to optimize it and analyze it and match you with some partners and who is the right fit, right? And just kind of take out that middle, that hard piece of it. And again, I think it's new. We do this in like wrap networks, out of area networks. We're starting to do this in pharmacy. Our goal is to say, can we help you optimize 100% of your spend, right? And so that's the premise. So back to your original question, we should measure that by savings. We're not doing our job unless you're seeing significant savings.
Yeah. So are you seeing savings?
Significant. So the company, I've only been here since May, so I don't want to take all the credit, but the company got its start on these out of area wrap networks and seeing just really significant savings by helping negotiate contracts and find, most of these groups are leasing or working with these national players who have these networks, and they don't have real visibility into understanding where they should work with. So they send us the claims into the marketplace. Imagine it goes through that magic machine. We have partners. We don't pick the partner. We just make it, allow them to look at access cost, quality, et cetera. And then we connect the claims to them. And so in that case, so we've seen significant growth in the last 2 years. And so now that's why we're saying go from that area into pharmacy and what are the next areas to spend.
Nice.
Oh, you have a fan club over here in the comments, BJ. So we're gonna take a little. What do you think? Right. How can smaller innovators in healthcare management who are measuring social impact and ROI partner gets the table? Yeah.
I mean, here's how I've thought about it. I think ROI is your ticket. Like if I'm looking, I'm making, that was Brittany, right? I'm making a bunch of assumptions, but maybe you're trying to get on the marketplace of a vendor like MacroHealth, or maybe you're like looking at an EHR or whatever. I think I'm on the board of a company that has kind of evolved from an eFax provider to an intelligent document processor. And their story is really incredible because you say, okay, most of us have spent a career saying kill fax. They're like, you're probably going to still use fax. Why don't we just take that and make it really smart, right? So I like that. and part of the pitch has got to be, you have all this stuff already, make that actionable. And that was sort of their ticket to kind of having these conversations with bigger EHR. So that's my thought is find right partners who share the right ROI story. And that's how we have to go. I would also say, just from a product view, we have to measure our product managers and measure our success of our kind of product. P&L isn't just about, did we churn in revenue? Obviously those are important, but like, are we delivering on the promise? Has to measure that.
Yeah. Can I ask you a question? This is like kind of related to government stuff, because we got to interview Abe Sutton and we got to get our shit together before 4 p.m. on Monday.
Practice.
But yeah, I know. But thankfully for me, Lisa just did a webinar on the access model. And I think so the recently released reimbursement structure. And there's a lot of like drama and gnashing of teeth in the industry because those reimbursement rates are much lower than expected. But the administration is saying, hey, if you guys say you can like do this cheaper, better, faster, and better patient outcomes, like this should be fine. Do you think, because you've got a lot of experience kind of across the board, do you think that we will see those reimbursement rates being appropriate?
I'm not an expert on the access model, but here's what I've always felt like until how would I say it? Until we burn the boats on the other side of the island and we say, this is how the reimbursement's going to go. We're not going to have really strong changed behavior. And so I mean, it's like, look at value-based care, or honestly, like even some of the interoperability stuff. Like we've got, until everybody's incentives are aligned, then we get like 70% there. So I would say embrace it fully and watch the technology and the incentives start going. That would be my push. I almost like am in favor of just saying, yes, this is what happens. Go figure it out and let the innovators win.
Well, I'm going to ask this question to Abe, so we'll see how it goes. But my provocative question, I probably shouldn't say. I'm going to poke on the primary care focus models that were canceled, and what has replaced it, and what that means about the view inside the department and inside CMS about the future of primary care, because people talk about this a lot. You talk to primary care physicians, independents. We're good friends with folks from AAFP, from Elation Health, from plenty of other places where they have smart people thinking about this stuff. And everyone rightfully says, like, primary care is under attack. There aren't enough, primary care is paid pennies on the dollar, blah, 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 like things that are real and has been happening for a long time. And for a while, for more than a decade at CMMI, for example, we, myself included, were part of building new primary care models and testing new ways to pay for primary care that, according to, CMMI statute, didn't bring the savings or whatever that were expected or hoped for. And this new access model is like, all right, we're just going to pay you on the specific outcome, figure it out, do whatever, use technology.
Yeah, the flip side of what I said is it puts all the pressure on paying for the right solution, right? Like I mean, I'll tell obviously, well, maybe not obviously, but what's near and dear to my heart for many, many years are our senior care providers, having spent the majority of my career there. And, on one hand, they benefited from the meaningful use back in the day where hospitals were getting all this funding to implement technology. They didn't get any funding, right? They were the secondary, tertiary effect. It said, if I'm going to work, I have to. So they've been nimble. They've been trying to get connected and without any incentive. So I think we have to, ideally it needs to work, but not share the responsibility across is really important.
Yeah. I'm excited to see what happens with access and just generally, what do we even with the MA providers and they're all stressed out about not making more money in the next year. But I do think interesting things might happen. So that's exciting.
I agree. Yeah. I agree.
Hey, so BJ, we have a lot of loyal fans, as you know, at least 1 million, and many of them are in product roles themselves. So I just have I don't know anything about product. I just put stuff on the internet, but
on TV. Okay.
I do that kind of stuff. But what is what are the biggest problems going on in your field right now in product land? We don't talk about this often.
Let me be Captain Obvious here and say AI is changing everything. If you haven't heard that yet in the last hour, but
we're still waiting for your thoughts on AI Assurance Labs.
Yeah. Listen, I think that we are, I think we continue to have a challenge within product itself and finding great products. Healthcare is a little bit different because if I'm building a consumer app, I could have my family and I could be on that phone and I can be testing it out. I think it's really important that we're not just stuck in what I call the build trap. So there's a great book for any product listeners. Melissa Perry wrote Escaping the Build Trap. It's one of my product Bibles. And the notion is that a lot of product engineering organizations or old school product organizations get stuck in this, you get a critical point of customers. They just keep telling you stuff and all you're doing is building and building and building forever. And you never stop to say, did I make it more valuable? Is it necessary? Am I solving the right problem? So I think spending more time with your customers up and down is really important to say, am I doing the right things to drive value? And then I think secondly, the AI point is just our jobs are changing fast. What I would say is the old school product role of I'm going to go build or translate requirement docs into a bunch of stories that the engineers are just going to churn out isn't going to be what survives. I think it's really about we're moving up the food chain here a little bit, right? Strategy is good. Strategy is actually more important than ever because the bar to put solutions in the market's lower. But the thing to remember that is the bar to put shitty solutions is lower than ever, right? So we really need to get good solutions. So strategy, how are we doing that? And then I think product as builders is the next thing, right? So we're just building prototypes in AI tools that can be demoed and skip 7 steps, get feedback in real time, and then go and so I think the product's changing, the roles are changing, and so I think so if I had advice, embrace every AI tool we can. We need to and don't just ask ChatGPT what the customer needs. Spend more time with your customers.
Yeah, get out of the market. Love it. Well, okay. So speaking of
ChatGPT doesn't know anything.
What are you talking about?
ChatGPT only knows what kind of nonsense has been fed to it in training, and your customers aren't. If they already said everything that they need, which by the way is changing all the time, then we wouldn't need any human beings anymore. We could just close up shop.
Exactly.
Yeah. So dumb.
I would argue same thing goes for any function that's not HR or something boring like that. Get out and talk to your customers, marketing people, like go
Totally.
on a plane,
Seriously.
do
Oh my
something.
God.
That would be totally great. Well, BJ, why did you pick MacroHealth? Because like from what I know, like everybody loved you at PointClickCare and didn't want you to go. So why are you going with these guys?
You know what? It's funny. If you ask my wife, maybe it's my midlife crisis. But I
have one of those like 7 times a year.
But I love my time at PointClickCare. I love the people. I love the customers. I really spent so much of my time in my career in that space. I just really fascinated by the challenge of helping healthcare be more affordable and drive down the cost and try to do it in an interesting way. And Kat, you may relate to this. I've been fascinated by these multi-sided network products for a while, at Collective Medical and others. And so that's it. So I think I'm inspired by the challenge, and I wanted to get back into a smaller growth company, right? PointClickCare is I don't know,
not a small company.
9 or 10 times. I was there for 9 years. I think we grew 10x in those 9 years. It was such an awesome run, but I wanted to go do it again, and get involved in some other things.
Yeah. I have a lot more questions, but I'm worried about asking ones that are like going to take up too much of our time.
Rapid fire answers.
Yeah. Well, we're not going to do that right now. Well, okay. Can we talk about health plans?
Yeah.
Okay. Just generally, how are they feeling about AI? Especially because you're dealing with like smaller.
Yeah. I would say my limited experience, it's a little bit mixed, right? So I think I'm walking back to make sure everyone knows these are my opinions, as Lisa said earlier. But I think on one hand, they see the promise. On the other hand, there's almost some fear about things like we can use AI to help us do certain things, but not other things, right? And so I just feel like in some ways, some of the plans at a smaller level are a little late to the game. I will tell you though, I just had MacroHealth's company kickoff, and we did like 7 or 8 kind of in-depth customer interviews to bring to the event, and every one of them had embracing AI as as their 2026 initiative, right? And so one of the interesting examples though was that some were talking about coding optimization, and others were talking about catching coding optimization. So I don't know, we'll have AI battle bots going at each other, but so I think they're, just like everybody else, is ready to embrace it.
Yeah. Is there so it sounds like coding is where they're starting, just like general, like looking at.
Optimization, finding anywhere you can automate, like where you've got a bunch of humans doing tasks, right? Some broader analysis. And then I think probably looking at like optimization is what and I could be hearing that because that's I'm coming from with them, right? So I don't want to say that they're only initiatives, but like, hey, how do we help optimize the spend? Or there's examples of like when they're looking at claim by claim where discounts aren't being applied or they're not. Like those are the types of things I'm hearing. So
there's an unmistakable push and need for automation and to cut back things that are manual or very human heavy processes. And especially the smaller a health plan gets, like the more likely they are to have a lot of paper processes still. Shout out to my PBM who sends me paper and has no other option. Thanks a lot, guys. Really love it. Love that love that someone is printing off every single one of those damn things and putting them in those automated envelopes for me.
It's
love
retro.
It.
It's
really retro.
It's retro. It's cool again.
Shout out, guys. Shout out. Awesome. BJ, you're great. You're a great guest. You can come back anytime.
Yeah, call us.
Absolutely.
So what position are you hiring for? Tell our loyal fans.
Yeah, I've got a director of product management. Good role. Going to focus almost entirely on that pharmacy optimization. By the way, that's 25%-ish of a health plan spend. So that's the biggest rock there is. So
nice.
Yeah, hit me up. let's
Yeah.
go.
Let's get some friends of the talk show.
Yeah.
Friends of the talk show working with BJ. Come on, guys.
You know, in addition to people funneling money to us for no reason, and also just in general giving us money, we could also start a recruiting firm. I don't know, Lisa, what's going to happen. But BJ, you're great. Thanks for coming on and telling us some stuff. And we hopefully will see you around. Are we going to see you at Vibe Hims?
I'm not going to Vibe or Hims this year, unfortunately.
Wow.
Let's do it. I want to come back at some point. Yeah, and let's see you around.
Come back and
talk
talk
each other
more.
in JP Morgan. So that'll be our
yeah. Maybe that'll be our annual reunion. TBD. All right. Well, you're the best. Thanks so much. Hey, and
check us out
Pittsburgh.
at 5.
You still in Pittsburgh?
Yep, still in Pittsburgh.
Niosh.
Nice.
Niosh is back.
The pit is back. The pit is back. More importantly, the pit is back.
I missed it.
Screw Niosh.
Let's do it. All right.
Thank
you both.
Okay.
Awesome.
Thanks everyone. Catch you all at 5 in a few days, few moments.